Hi, good evening.
Oh, there you go, Dr. Crawford. We're going to have a discussion tonight on CBD and hypertension, and the reason why I chose hypertension tonight is, as you all know, they have rolled out the vaccinations, right? They're giving the vaccinations first to healthcare professionals like myself and Dr. Crawford, who absolutely is in the front line of taking care of COVID positive patients. And Dr. Crawford, my blood pressure was like 176 over 96 before I got
Wow.
the vaccination, right? I don't have a history of hypertension, but I'm telling you guys, Dr. Rita was a little anxious. I had a little anxiety blood pressure going on that day, which was the last Friday I got the vaccination, but I'm fine. I'm fine. But that's one of the reasons why I chose this topic, because many of us do get what we call white coat syndrome. We get a little anxious and nervous before we go in to see the doctor. Um, Dr. Crawford, because your family practice, if you could just talk a little bit about what hypertension is, as I find my slides, if you're available to do that.
Yes, sure. Hypertension, we also
Are
call
you
it,
able to show your video?
no.
Oh, okay. We're not able to see your beautiful face. That's okay.
um, so high blood pressure is hypertension, and that is the pressure that is measured as blood flows through our blood vessels. And that's what is measured, when you get your blood pressure checked. And blood pressure, the best blood pressure for most people under 65 should be less than 120 over 80. If your blood pressure kind of continues to creep over 140 over 90, that's when there's some discussion of some lifestyle modifications that happens. And the reason why we are concerned about high blood pressure is because of the outcome. So if blood pressure is persistent and or extremely high, you can develop a stroke, heart attack. Um, it's called a abdominal aneurysm, where the largest blood vessel in your chest and abdomen can burst, and that's unfortunately for most people immediate death. There's also blood vessel problems that can happen in your usually lower leg, and you hear that as peripheral vascular disease, which could lead to amputation, loss of limbs. So those are the consequences of persistent high blood pressure or severe blood pressure.
So, what are some of the medications that we're using?
So the four major blood pressures are classes of calcium channel blockers, and they help on a cellular level to decrease the amount of blood that is the heart basically forces through our body. And then there's we call them ACE inhibitors or ARBs, and they work at the level of the kidney to try to decrease the amount of salt and fluid that we would intake, that once again increases the amount of fluid that the heart has to pump. Um, and those, a common name ends in pril, like enalapril or something like that, lisinopril. There is a third group called beta blockers, and they help decreasing the overload of, once again, how the heart pumps. And then the fourth class, common class, people say water pills. They're usually hydrochlorothiazide or furosemide, Lasix. Those are another class that helps to decrease the blood flow, mainly acting on our kidney. So those are some of the more common blood pressures. And there's other ones that will have different mechanisms, but that's and usually on average for difficult to treat blood pressure, on average people are on like 3 to 4 types of blood pressure pills.
Wow.
And every blood pressure, every medicine, aspirin, um, diabetic pills, everyone has their pluses and their minuses, their indications, their benefits, but their side effects. And so those classes have different side effects. So for instance, mentioned the calcium channel blocker, that one, for some people, they might get constipated or they might have swelling in their legs. The ACE inhibitor is common to give a cough, and more common in African Americans, you might have a reaction that people have a swollen face or lips or something like that. And then the beta blockers, if it's too high, you could get dizzy because your blood pressure and heart rate can get low. And then the water pill, once again, some people are sensitive and they can urinate a lot or have loss of their sodium and potassium. So that's why sometimes there's a supplementation of potassium. But like I said, there are some benefits, but there are the side effects too as well.
Got it. Yeah, there are so many people that are on lisinoprils, those ACE inhibitors, and they have that chronic cough. And they go through major workups to find out it's a side effect from their medication. So
Right.
that is really something that we always have to have in the back of our mind, along with sexual dysfunction. You know, that's why a lot of people do not like taking their medication because of loss of libido.
Right. In addition to having the blood pressure itself, because the blood vessels are also in the penis. And so if you don't have great blood flow, then that's one of the side effects. But also, as you said, the medications some medications in general can decrease the libido too as well.
Yeah. Yeah, I can see my slides, but I'm having a hard time sharing them with you guys. Let's see here. Google Drive.
And with the blood vessels that we have, part of the um, mechanism is inflammation of the blood vessels, and causing also what we call constriction or decrease in the size of the blood vessels that can increase the blood pressure number.
So, what are some of the other natural things that your patients are looking to use or have used in the past, as I'm still trying to find these slides, for their blood pressure?
Well, some things are meditation. You know, as you mentioned, you kind of got a little bit anxious
Yeah,
and
I did.
stressful, and your blood pressure was like, what?
It was high. Oh my goodness.
So there's, you know, meditation that can help some people. Um, let's see, for, like I said, salt sensitive people, you want to kind of look at your processed foods, maintaining for some people less than 2,300 milligrams of salt. This is actually like the tip of your fingertip, a teaspoon of salt a day. So that's kind of hard when you have to restrict with your salt intake. And then of course there's the cannabidiol CBD that helps with the inflammation, as I mentioned, in the blood vessels.
So diet, exercise, meditation, weight loss, all of those
Sleep.
things.
Yep, sleep and getting your 7 to 9 hours of restful sleep helps the blood pressure.
How does that work?
Well, more of the mechanism, I believe, is more related to and here I'm blanking. I guess I didn't get my sleep.
Yeah, I mean, whenever you're talking about hypertension and constriction of vessels, whatever can relax um, the hormones. When we sleep, we talk about a serotonin and dopamine. All of those release will cause relaxation too, and a reduction, in inflammation of the blood vessels. All of those things improve blood pressure.
Right. Thank you.
No worries. Basically, the only thing that I have here at the hospital are my little gift bags that I'm giving to the nurses. And what I have in here is my empowered hair, my Dr. Rita's rub, and my broad spectrum gummies. The reason why I chose this gift bag that I was giving to the nurses is because so many of the nurses do have random drug screens. And so we want to always use products that will not show up in the drug screen. And our empowered hair is a product that you can use topically and it won't show up in the drug screen. Unfortunately, I wanted to talk about hypertension, but I don't have the products here to show you, which are our tinctures that, again, like Dr. Crawford said, will help to relax the vessels, will help to decrease inflammation, will help decrease anxiety, which I had last Friday, which caused my blood pressure to be super, super high before the vaccination. CBD not only will decrease anxiety, it will help to dilate the vessels. It will help decrease inflammation. So my apologies. I have a brand new laptop. Obviously, I don't know how to work it, but just to let you know, that will help to reduce pain, will reduce inflammation. A lot of times, someone's blood pressure can be high because they're in pain. They can be in pain due to arthritis. They can be in pain due to a lot of the autoimmune disorders like lupus, fibromyalgia. They can be in pain due to rheumatoid arthritis. So this product is a great product to reduce pain. And I love it because, again, if you have a random drug screen at your job, none of our topical products will pass through the blood-brain barrier. So you can safely do a urine drug screen and pass that urine drug screen without any issues. The other nice gift that I have for the nurses are our broad spectrum gummies. I put the gummies in this beautiful tin bag, this tin container, and the broad spectrum gummies are our gummies that contain less than 0.0% less of THC. This is another product that can help reduce inflammation, it reduces anxiety, which in turn, when you reduce all of that, can reduce your blood pressure. Again, one gummy of our broad spectrum is 60 milligrams of CBD that can safely be used during the day. If you have nurses that during the night, which I'm working nights, that they can safely take. Now, in this cute package, I put a brochure, right? I put a brochure in the package that I'm giving to give them information about how CBD works. And how CBD works is through science. And the science is called the endocannabinoid system. The endocannabinoid system is a system that every single person in the world has. And this system is looking for CBD. This system is looking for cannabis to help reduce and to put the body back in balance, but help reduce inflammation, to help reduce anxiety, to help reduce the constriction of vessels that we see in hypertension. So these receptors are found in the heart, the lungs, the liver, the kidney, the bowel, the skin, the teeth, the heart, the brain, the central nervous system. All of these receptors in major organs in our body is looking for CBD to put it back into balance. So with this cute little Christmas care package, the person can learn about what CBD is. CBD is an abbreviation for cannabidiol. Cannabidiol is one of the #1 compounds that the hemp species of the cannabis plant makes. It also gives what conditions CBD can benefit. CBD can benefit blood pressure, which is what we were going to talk about tonight, but Dr. Rita can't get her laptop to working. It can also help reduce blood sugar. It can help reduce cholesterol. It can address hormones, insomnia. It will address chronic fatigue. It will address tumor, seizures, fibromyalgia, more. So all of this is going to be in their gift care package that I'm giving to every single nurse. It also explains our unique story. See, CBD is not made equally. There is a lot of CBD companies and a lot of CBD products out there, right? But we know that our products here at Wakana are unique. It talks about our unique story. You may ask, well, what's so unique about your products at Wakana, Dr. Rita? Well, our products are formulated to have very unique proprietary formulation, meaning that we have added to our formula essential oils like turmeric and black seed and peppermint that make our products unique, make our products different than any other products in the marketplace. Our gummies are unique. Our gummies are infused, they're not coated. Most gummies in the marketplace just have the CBD on the outside, but the CBD on our gummies are infused, which make them more potent. They really get down to the cellular level. What else makes our products unique? Well, our products are organically grown. Our farms that are organically sourced from Colorado, Oregon, and Kentucky. Our products are also third-party validated and tested, which means that we have an outside lab, an unbiased lab that tests every single product that we offer at Wakana. And we do that to ensure the safety of our products, to ensure that you are getting a product that is free from mold, mildew, heavy metals, and pesticides. Because when you consume a product that has mold in it, or maybe a product that has pesticides, or even a product that has heavy metals, and you're trying to address hypertension, then that product could potentially not only increase inflammation, increase the constriction in vessels, but also can be harmful to someone who is immunocompromised, someone who may have cancer, someone who may have an autoimmune disease where a heavy metal could make that condition worse. So our products are tested. Our products are organically grown. And every single product that we offer has a certificate of analysis, meaning that there is a certificate that shows you that it's been tested for all of those things we talked about, right? And what I love about our product line, again, we offer something for everyone. We have products that you are using in your kitchen. We have a CBD. We have smokable products. There are folks that like to vape. They like to smoke. They like to use the flower. Those are called smokable hemp products that they don't get you high, but they give you the health benefits that you're looking for. We have products that are water soluble, right? I told you that I had a water accident with my laptop yesterday, and I had my CBD in my water bottle, but again, it didn't help my laptop, but it did help my anxiety, right? CBD can be placed in your water, in your smoothies, in your food soluble product. And then we have our traditional tinctures. Our tinctures are products that you can place underneath your tongue and get those CBD absorbed in the bloodstream. And then we have topical products that we talked about. We have topical Dr. Rita's Rub. We have a topical salve. It's a cream. We have those as well. So this is what makes Wakana products unique. This is what makes our CBD stand out and are like no others. And then again, the science. So all of that is in this brochure. It talks about the difference between CBD and medical marijuana. Again, medical marijuana is a product that has very high levels of THC. Our products contain no more than 0.3% or less of THC, which is the legal limit in the United States. So these are little gift items that I'm giving the nurses. Again, I was very strategic in which products, because I understand these nurses do have random drug screens. So all the products that I picked are topical. This is empowered hair that we use to strengthen edges, to have that luster. Oh my God, my hair is so nice and shiny, right? We want the sheen to our hair. We want the shine to our hair. This is a product you add topically to the area that's thinning, to the area that may be breaking because of stress, because of the diet you may be having, or because of the hairstyles. It's called traction alopecia, where we wear those weaves, we wear those wigs, we wear those braids, and guess what? Our hair starts to break off. So hemp-powered hair is what I'm giving them. I'm giving them Dr. Rita's Rub, because why? They're on their feet. These nurses are on their feet 12 hours a shift. Where can you roll this? Because this is a roller ball. I always roll this right on the soles of my feet for achy arches, achy feet, achy back. You know, the nurses are pushing with patients. They are moving patients after surgery. So this is like strategically, I knew this would help them. And then again, our broad spectrum gummies, I put 5 gummies per nurse in each one of their packages. Right. So again, Dr. Rita is so sorry I cannot share my slides, but the topic tonight was supposed to be CBD and hypertension. Dr. Tyus Crawford talked about hypertension. This high blood pressure affects minorities at much alarming rates. What happens if you don't address your high blood pressure? Well, you can have bad outcomes because of the organs that blood pressure that is not treated can cause. It can cause stroke, it can cause aneurysm, it can cause long-term kidney damage and dialysis. And a lot of times we will see elevations in blood pressure from what we call white coat syndrome. You know, you get anxious before you get to see the doctor. Or hypertension can be caused from long-term chronic elevation of pressure in the vessels. It can be due to your diet. It can be due to obesity. It can be due to kidney or renal insufficiency or dysfunction. And what are some of the treatments for hypertension? Well, in medicine, we use different medications to treat hypertension. There are different classes. Many of the classes of medications that we use to treat hypertension can cause side effects. The ACE inhibitors, the lisinoprils that you may know about, can cause chronic cough. A lot of the other medications can cause issues with libido. A lot of people will stop taking their medication because they don't have a sexual drive. We also have a CBD lube for that, right? We have a CBD lube that will help to enhance a sexual encounters, will enhance your libido, along with these gummies, right? These gummies will help to relax you, to relax the vessels, like Dr. Crawford said, in the penis, to help with erectile dysfunction. So all of our products can be used to address and assist symptoms that high blood pressure can cause. But you absolutely want to do all of the other lifestyle modifications: sleep, mindfulness meditation, yoga, exercise, and making sure that you have a diet that's plant-based, a diet that's not full of processed food and fried food and things like. So yeah, I'll do this lecture at a later date. Is high blood pressure linked to hormones? Yeah, women, definitely postmenopausal women, and the reduction in estrogen puts women now at 2 to 3 times risk of having heart disease because of the changes in hormones. So yes, absolutely. And what I love about CBD is that we all need CBD. We all need CBD because our bodies actually produce compounds just like the cannabis plant makes. Those compounds, when they are deficient, when those compounds like 2-AG and anandamide that our body normally produces, they're called endogenous cannabinoids or endocannabinoids. Our bodies are deficient, we need to consume CBD. Think of CBD like a vitamin, right? I take my CBD every single day. Every single day, I take my CBD in some form or fashion, either in a gummy or the soluble or the seasonings. I use the seasonings and my egg whites. I typically have egg whites with veggies every single day. So I'll use the CBD seasonings. So there's different routes and ways that you can consume CBD, and Wakana makes it very, very easy for you to do that. Definitely you want to give only Wakana products for your Christmas gifts. Why? Because folks are looking for healthy, organic alternatives to their wellness. They're looking for alternatives to their health. We don't recommend that you stop taking your blood pressure medication unless it is with the guidance of your physician. Will CBD cause a reduction in your blood pressure? I have found in using CBD with my patients that it has. It is a vasorelaxant. It is an anti-inflammatory. And when we look at high blood pressure, we see inflammation around the blood vessels. So you want to make sure that when you are using CBD to assist with blood pressure, that you let your doctor know that you're going to start CBD. You want to engage your physician in your healthcare. If your physician is not interested in being engaged, you need to find another physician. Why? Because this is your health. This is your body. And your physician should always want to partner with you when it comes to your health. So you want to engage your physician with your desire to use CBD in conjunction with your existing medication. So you never want blood pressure medication because it truly is and can be high blood pressure, a silent killer. So, any questions? Yes, blood pressure it can have some sort of hereditary component, but most of the hereditary component that we see in our community is a cultural component, right? You say, my mom, my great grandmother, my grandmother had hypertension. But a lot of times when you look in some of these families, you'll see that there is a long history of poor diet, right? A long history of what we culturally love to eat, right? The fried chicken, the mac and cheese, the highly processed and over sodium use sorts of diets. Oh, so Erica, absolutely, you can share your testimony. Erica, I will switch you over to be a panelist, and you can put questions in the chat because we still have 15 more minutes to chat on this line. Erica, are you out there?
Hi, Dr. Rita. Yes, I'm out here. Hi, how are you?
I'm great, thank you.
You're welcome. So I just wanted to share, I was just thinking about it. I was hoping that he would be able to join himself, but my husband has a business partner that he drives with. He's another tractor trailer driver or car hauler. And so he had shared with us that he's been able to reduce his high blood pressure by using CBD. So he's very elated by that. So I was trying to ask him what does he use, but because he's a tractor and a car hauler, I keep saying tractor trailer driver because my husband so long. But I'm pretty sure that he uses the pure tincture. I think it's 300 milligram tincture. And now he's also a business partner, so he has plenty of CBD products in his own, and that he can retail himself. But and possibly the gummies. I wasn't able to reach him to find out exactly what he's using, but I know he had been taking it for maybe about 60 days, and that was probably about a month ago, so maybe 3 months now, and it's assisted him in reducing his blood pressure. And then I also wanted to share my mom, who is also now a business partner, but she had spoken to her. I've been trying to get her to use CBD, and she was reluctant, and she was like, I don't know, I'm not sure if I can use that with my medications. And, I had given her your talk before, and but she was reluctant, right? But she saw her doctor a couple of weeks ago, and she asked him about it, and he was like, oh yeah, sure, go for it. It's a good idea. And so I was really glad to hear that. And so it made her feel better to know that he was on her side and that she could do that with his knowledge, and that he would just have to check her blood pressure to make sure it's not getting too low. And so, so I was really glad to hear that, because I do have an aunt that had high blood pressure. It was out of control, and she's on dialysis. She just had, and what I learned today was what Dr. Tias was just sharing. Unfortunately, fortunately, she's fine, but she just had to have she had an abdominal aneurysm. She just had to have surgery on Monday. And I'm so grateful that she's fine, but I didn't realize that was probably something that came from her blood pressure being out of control for so many years. So that's knowledge for me. But I just wanted to share that because I just thought it was great that people are getting the benefits of it assisting them and having another alternative.
I'm so glad that you shared those testimonies with me. And again, because we all metabolize CBD differently, we all have different body chemistries, we may need different amounts of CBD. So we always talk about, right, Erica, starting low and starting slow. So whenever you're starting any CBD product, start low. Start with 3 drops twice a day of the tincture. Start with half a gummy and then increase it to 1 gummy. Start with 1 teaspoon of the seasonings, because remember, the seasonings do have some sodium in them, so you don't want to overdo it with having a lot of sodium, and you're trying to, reduce your blood pressure. So starting low and slow, always knowing that you can increase that as time goes on. But again, when we think about high blood pressure, you've got to remember that blood pressure can be elevated with anxiety, like I had on Friday, right before my vaccination. It can be increased due to pain, like you have a lot of pain that's getting out of control. You want to make sure that you're using our topical products so you can control that pain so it doesn't increase that blood pressure. You want to control your anxiety so it doesn't increase your blood pressure, right? So all of these things you've got to remember can be a trigger for those who have existing blood pressure, or it could be a trigger for someone like me who doesn't have a high history of high blood pressure, but absolutely can reduce those triggers with our products. Any other questions? Someone is saying, I use the Hempradian 500 and I'm off blood pressure meds now. So that is great. I'm not sure. Oh, I think that's Cherie who just said that. Again, you always want to work with your physician in collaboration when you're using CBD products to assist. Yes, Cherie, thank you so much. When you are assisting, using CBD to assist with symptoms due to a lot of chronic illnesses. So happy to hear that, Cherie. That is really good. I mean, whenever we can reduce the amount of medication that we're on is always good, because long-term use, we know, is of course going to cause effects on in-organ damage, like your kidneys, like your liver, and other organs that hypertension can long-term affect. So great testimonies. Any other questions at all about any of our products? I'm looking in the chat to see if I missed any questions. Again, my apologies. I have a brand new laptop and I cannot figure out why I can't share my Google Drive. And the Google Drive are the slides that I have prepared for CBD and hypertension. Again, just an overall synopsis. CBD can assist with those who have hypertension. How does it do that? CBD is an anti-inflammatory. When we look at hypertension, heart disease, diabetes, obesity, arthritis, those all have a common denominator, which is inflammation. You reduce the inflammation in those blood vessels, you will improve your blood pressure. 2, CBD is an antioxidant. Antioxidants are really important because free radicals can start to destroy and break down your body. So as an antioxidant, CBD helps to improve blood pressure. CBD also is a vasorelaxant. What that means, it causes the vessels to relax, to dilate, and not to be so tight and be constrictive, right? So CBD has been shown to be a vasorelaxant. CBD is also helps to reduce anxiety. So that helps to reduce blood pressure. When you have a lot of anxiety, or we call those type A personalities, you can reduce your blood pressure as well. The science is there. The science is the endocannabinoid system. That's the science behind how CBD works. If you ever want to see or read any articles, all you need to do is use your favorite search engine and type in CBD and hypertension. You will get lots and lots of studies, lots and lots of research. You can even share with your doctor, right? Again, if your doctor is not interested in reading or being open to this information, you may need to find another doctor. Your doctor should always be open to collaborate with you on ways to reduce and to limit traditional pharmaceutical medications. I was trained at Wayne State School of Medicine in Detroit. Absolutely, there is a role for pharmaceutical medications, right? We've got to get your blood pressure down. You can't walk around with high blood pressure if you do and left untreated, can be a very, very detriment to your overall health. But we also want to let you know that there are alternatives to your health. There are natural, organic, holistic alternatives like CBD for your health. So, wonderful. Any questions? Any other testimonies? Does anyone want to say anything? Dr. Mitchell, you're there. You can unmute yourself if you want to chime in. We still have 6 minutes. And again, if you are a guest on the line, I want to apologize to you for not being able to share my slides. But if you're a guest on the line, you want to make sure that you connect with the person that invited you, because they're going to want to share with you our tinctures, our gummies, our topicals, and our smokable products to assist you with whatever symptoms that you're looking to address.
Hello, Dr. Rita. How are you? This is Dr. Mitchell.
Hi, Dr. Mitchell. Dr. Mitchell is an internist here in Chicago who deals a lot with high blood pressure, hypertension. How are you this evening?
I'm doing fine. How are you?
I'm great, thanks.
I have been using CBD in my practice for about the last 60 days to treat hypertension. As you know, internal medicine sees a large proportion of hypertensives, and I have a great interest in having the best treatment possible for that because of the disproportionate effect that cardiovascular disease has on the African American population. So far, I'm in the middle of my studies, but so far I've had at least 5 out of 15 people be able to get off multiple medications, which is very difficult to accomplish otherwise. Now, there's some lifestyle modifications that they had to do with it, like lose weight and get off salt. And those that are aggressive with that approach have had great success. But I'll be sharing more information with you about that as we move forward. But I'm very grateful to have something like CBD and be able to explain to my patients that this really is a scientifically based treatment to move forward with that doesn't have so many side effects that I kind of got to convince the patient to stay on the medication. So this is great.
Wow, thank you so much, Dr. Mitchell. And I really look forward to the rest of your studies and the data that you're going to get from your patients. And thank you for sharing that with us. And thank you for being that type of physician that's open and willing to work with your patients when they are looking for a natural and organic, holistic way of addressing their health. So thank you for that.
Oh, you're welcome. I had great interest once I found out that it was scientifically based. It's
Yes.
very nice to be able to refer to the endocannabinoid system as part of the human body. And when I'm able to tell most of my patients that part, there's a lot of interest just solely based on the science of it.
Right. You know, a lot of people, when they hear all of the medical benefits of CBD, they're like, is this a snake oil? Is this true? But when we show them the science, I mean, there's science behind this, and the science is the endocannabinoid system, like Dr. Mitchell referred to. The science is there, and so it's fascinating to know that this is not a snake oil. This is not a magical potion. This is not something that was just created out of the air. That this is something that's been used. In fact, you know, this has been used since 2737 BC for so many conditions that we are now fast forward looking at to address today. So I'm super excited to have an internist, family practitioners. We've got psychiatrists, clinical psychologists. Erica is a licensed clinical social worker. We have so many healthcare professionals here at Wakana with our Wakana Medical Advisory Board that believe in the product, that use the product with their patients. And we're excited to share this information with you. But do your due diligence. I always recommend do your due diligence, do your own research. And again, if you're a guest on the line, please connect with the person that invited you so you can get these products into your system. So if there's no other questions, we still have a minute to spare. Let me look in the Q&A area, make sure there's no questions there. Nope, no questions there. Thank you, Dr. Tyus Crawford, Dr. Charlotte Mitchell, Erica Zachary. Thank you for joining me this evening. Thank you, guests, and thank you, business partners here at Wakana. Have an amazing holiday. Merry Christmas, Happy Hanukkah, all those things. Make it a safe holiday. Be well, and we will see you next week. Thank you so much. Happy Kwanzaa.